my colleague who is on the board of CUI. Hi, Zahra. I know you're coming into us from the University of
Toronto
Toronto.
Metropolitan University.
Yes, well, tell you, we've had an interesting time here talking about the lessons from COVID, the last 1,000 days to the next 1,000 days. So we're going to skip. The minister is to be arriving any minute now. So the next session was to be with him, but he's not here quite yet. So I'm very pleased that Carolyn is here with her colleagues, and I'm hoping we can just jump to the conversation about making better decisions. The thing that sort of birthed this one, which I know that Jennifer and Carolyn are keen on, is how do we make better decisions? And did we, hi Jean-Noé, and how do we actually, what needs to inform those better decisions? So Zahra, I'm going to pass to you, and then you can get input from each of these three about their particular experience. I'm going to turn my camera off and see if I can find out where the minister is. And over to you, Zahra.
Okay, amazing.
Thanks
and
for
Mary,
joining,
how much time do we have, Mary?
Not very long, you know, as always is the case. This is really, we were calling this the urban telethon. So basically every session is about 12 minutes and basically focus on the last 1,000 days, what you've really learned and what should be, what sticks for the next 1,000. Carolyn's been on, so she knows the drill, but you've got about 10 or 12 minutes. Okay.
All right. I'm going to keep my comments short, but I'm going to say a warm welcome to everyone. Thanks for joining us. And I would love to hear, you know, the topic, making better decisions. I think it would be really great to hear from each of you. What does better look like? And what's a case study? What's an example of a decision that got made differently in the last 1,000 days that has something in it for us to learn from? And Jean-Noé, I'm looking at you because I haven't seen you in a long time. So maybe I'm going to pass it to you to go first.
Great. Nice to be here. Yeah, I mean, I think in terms of what we've learned over the last 1,000 days, and there's been so much, right? And I mean, I guess where I'm going to go with this is less about the technical nature of kind of the data component. There's obviously a lot that we've learned around collaborating and sharing data, but it's the kind of the scientific communication aspect of how do we, you know, bridge and enhance literacy around science in a way that is much more accessible and impactful to people that are directly not only impacted by the science itself, but also in need of data to inform their own, you know, decisions on their own personal livelihood. So that's one. I think science communication is something we've learned a lot over the last 1,000 years that can also be adaptable to issues related to climate change, for example. And then there's also the fact that because we were operating in a period of crisis, that there was a lot of new kind of incentives to collaborate across sectors, within sectors, across sectors, between sectors. That doesn't happen by magic. We know that there's a lot of ways that, you know, to do that. And I think we've seen like an emergence of like intermediaries, you know, that can help navigate between sectors to facilitate that type of intersectoral collaboration.
Great. Okay, I'm going to quickly pass it. We're going to tie the threads together in a minute. We're going to go over to Carolyn. Same question.
Thanks, Zahra. I think there's been some amazing natural experiments during COVID. One of them was CERB. We haven't mentioned CERB yet. Across Canada, the lowest income quintile saw their incomes increase by 529%. And we know that core housing need dropped from 1.7 million in the 2016 census to 1.45. So it dropped by 250,000 people. And StatsCan is the first to say that that was because of CERB. So that was temporary good news, but the census occurred during 2020. CERB ended by the end of 2020. And now we see vastly increased homelessness. And we see one of many possible solutions right there with lots of evidence, which is raising absolutely punitive social assistance rates to a level that people might actually be able to live on. So there's lesson number one from evidence. There's also been a couple of really dire natural experiments. One of them is if you put a bunch of people together in inadequate housing, will they die? Answer, yes. So we've seen greatly increased deaths in shelters, and we've also seen greatly increased death in long-term care where people are crammed in shelters, 10 to a room, in long-term care, 3 to 4 to a room with inadequate supports. And the absolutely dire death and disability costs of those completely rights ignoring, inhumane conditions, completely unnecessary in a rich country like Canada. So, you know, we have the evidence, for instance, that privately owned for-profit long-term care killed a lot more people, 2 to 3 times as many older people as publicly owned long-term care. That's research from my colleague Martina Gust. So, you know, the evidence is out there. The natural experiments have occurred in the last 1,000 days. I like the way that Jean-Noé said 1,000 years. It feels like that sometimes. Will we learn from them?
Yeah. Yeah, there's this thread right around, like, you know, how are we ensuring that the public is understanding, comprehending, and receiving this information so that they can take action, whatever action means for them in their day-to-day. So many questions, so many reflections, but I want to go to Jennifer next.
Thank you so much. Gawita Madanawa, the Wihawaniya, Jennifer Moore Rattray, really proud member of the Pikasis Cree Nation, and really proud to be Chief Operating Officer with Southern Chiefs Organization. Normally, I'm in the center of Turtle Island coming at you from Winnipeg, but today I happen to be at the Assembly of First Nations, big assembly, first time we've all been together in a really long time. So it's actually wonderful. And so I'm coming to you from the Anishinaabe, Algonquin, the unceded Anishinaabe and Algonquin territory. So really important to start with that in a good way. A couple of quick points. I actually wrote them down because I know I have such a short period of time. I don't want to miss this really important opportunity. So I really want to just ground us all, and I'm sure we are in our own communities, but ground myself in the fact that a woman passed in a transit shelter last night in Winnipeg. It was minus 31 degrees. There is no reason, and this has been said how many times, no reason that in our prosperous, beautiful territory that anybody should be dying alone outdoors. So we need to talk about that. We need to tackle that. So very specifically, COVID, what did we learn? And this actually feeds into that. And that is that we need a First Nations, we need an Indigenous-led response to crises, that we need a rights-based approach. And for us, that meant actually sitting. Now, we had to elbow our way in, but sitting at the provincial decision-making table when it came to COVID vaccinations and the COVID rollout, et cetera. Not a seat at the little kids table, which is what we normally get, but actually a seat at the big kids table, right? At the adults table, where we should be making those decisions and fighting for our doses, quite frankly, which we were able to do. Data, it's been mentioned here before. We were able to demonstrate a 17-year differential in response. So we were able to advocate for a 20-year differential when it came to vaccination rates. That saved hundreds, if not thousands of lives. So data is so important. We wouldn't have been able to get that get that difference acknowledged if we didn't have the data to prove it, and the disproportionate impact on our people. As you know, I've said this before, there is an 11-year and growing gap in life expectancy in Manitoba between First Nations and all others. Couple of other quick things. We then had the resources to be able to purchase and distribute things like rapid tests, masks, hand sanitation, all of that much more quickly than governments were able to get that to us and our people. We had that distributed. So that is a huge success story, and we're so grateful for that opportunity. What were the results? We had a higher than the average general population vaccination rate for first and second doses. That's significant because trusted sources were saying it's okay. It's a good thing. This is good medicine for you. Finally, the value, what did we learn? What's our COVID dividend? The value of working together in true partnership, real partnership. That was really to solve those wicked problems. As you know, in Manitoba right now, over the last week, you will all have become aware through the national news, the death of 4 more women to MMIWG, Two-Spirit Plus, right? An alleged serial killer. So we need to take the lessons, the COVID dividend, what we've learned by working together so effectively through COVID, and look at those other wicked problems like the housing crisis, like MMIWG 2S+, et cetera, like poverty. Let's break the back of poverty. We can do it. We're smart people, but let's really actually sit down and get it done, because this is a life and death situation for us. The final, I guess, quick point I would make is just that I think working together is good medicine for all of us. It's good medicine for First Nations, of course, and it's good medicine for all Canadians. So let's work together and really be the Canada that we know we can be. Egosani, thank you.
Amazing, such rich comments, and so impressive how quickly you did it. I would just really quickly say, I just want to weave something together or pull a thread that you sort of laid out, Jennifer, which is the adults table being sort of penetrated the porous membrane, it's like it is now. And it's something we saw, Mary spoke about mutual aid in the last session. We saw grassroots leaders, community organizers getting called into City Hall to say, how do we get help to the folks who most need it? You're the ones on the ground that know it. So I'm really curious, just based on what you said, to hear from everyone, where did you see sort of alternative decision-making models really do well? And Jennifer, you've already started speaking to it, but where did you see alternative actors or data sources or different kinds of wisdom being used to make great decisions? And I'm thinking about, qualitative lived experience data. Storytelling actually became a good data point during the pandemic. I saw in some of my mutual aid work. So I'd love to just hear from all of you, where were you seeing that sort of adults table be permeated by new ways of doing, being, or new people at that table?
Well, I've got a little problem with the adults table because I think that children often have really great insights. But I think it is really important to listen to the experts of lived experience, which is one of the things that I really gained from the last session from the Victoria encampments. And I think that, I worked in local government. I'm a great believer that local governments, for all their flaws, which are many, are sometimes a little bit closer to what can happen and needs to happen in their communities. And one of the big disconnects in housing policy is between multiple rules-based, different long applications due at different times for housing, and what municipalities know needs to happen right now in terms of, for instance, an acquisitions fund to deal with those really insane REIT statistics that we heard in the last session from Victoria. So I'm not going to say whether municipalities are more or less adult than the federal government, particularly before the Minister of Housing speaks, but I would say that there needs to be a lot more active listening.
Yeah. Thanks, Carolyn. Jean-Noé, Jennifer?
Yeah, just very briefly. I mean, I think part of what's different now that we've noticed around or during the pandemic, well, and you've kind of hinted at it, is the value of public narratives, and actually kind of recognizing that as a very, very rich set of not just information or like hearsay, but actually like things that we need to be better equipped to be able to understand and to pick up and to collect and to analyze, and to do so in a way that is accountable and transparent. And so there are many different methods of collecting that type of information to inform public policy and whatnot. But I don't think we're necessarily being very upfront about how we're managing those data sources, which can talk to and expose, vulnerable populations in terms of protecting their identity and protecting, sense of security and whatnot. So I think that's really, really important. We've also heard through those narratives stories of self, stories of us, stories of now. So how do we kind of integrate that into the work that we do? And just one other point here is also kind of learning around, that government can't work in isolation from citizens and residents. I think we've seen kind of the interdependencies that exist there. And it is in a moment of crisis when there are trade-offs on civic liberties that government needs to be more open. So we need to double down on open government and fundamental values of transparency and accountability and civic engagement.
Awesome. Jennifer, I don't know if you have anything to add before our instrumental music, Mary, takes over and pulls us off stage.
I'll be very quick because I made most of my points earlier. I guess the thing that I think we are really discovering, and I don't think as First Nations we're alone in this, the mental health and wellness crisis that we're now seeing, that of course was there, but has been exacerbated by isolation, by fear, by the collective trauma we've all suffered, quite frankly, through COVID. Some definitely more than others, but it's there. So that's the next piece that we are really struggling with. And quite frankly, the almost complete lack of addictions support in Manitoba, in our territory. That may well be the case across the country. country. I certainly can't speak to that, but we are really, really struggling with that, and with an appropriate, culturally safe First Nations response. So bottom line, we need to be able to be financially resourced to be responsible for our own healing, and for giving us the ability to actually end the impact of this big colonial project. So that's what we're really working on.
Indeed, the big colonial project, indeed, called Canada. Zahra, thank you. I'm having to step right in because we're on a schedule. You know, just to reiterate what Jennifer and Jean-Noé and Carolyn just talked about, one of the previous sessions talked about urgency, focus, and resources. And the data piece is such a critical piece of that. I mean, you need resources to get data. It has to inform focus, and it has to inform how we actually respond to this kind of urgency and how do we sustain that. So thank you. Really great to have you three back on City Talk. The conversation never ends. It's only continuing. And we're going to look forward to 2023 when we start to really tackle what the things that stick need to be. What are the policy changes? What are the resourcing and revenue changes, which I know is important to all three of you. So thanks for being on with us, and thanks for taking more time to talk about your particular perspectives. We appreciate it very much. Zahra, I hope you're going to hang with me while we move to the next session, which is all about making better communities. And